it's having across the board impact. Cancer is obviously, since it's a genomic disease, more and more sequencing is helping to guide the therapy and the follow-up of patients to respond to the therapies. So, I think we're seeing it there. And what's exciting to me is that we may, in the years ahead, get ahead of cancer like never before, because from this tube of blood in people who are at high risk, such as your genomic screen for predisposition variants in your genome or your family history, you'll be getting a assessment every 6 or 12 months for various proteins and gene variants. And that tube of blood could make the diagnosis of microscopic cancer before it ever would appear. And people don't die of cancer from cancer per se until it metastasizes. So we could really see an enormous impact in cancer. Obviously, the whole outbreak of the pandemic was a breakthrough in genomic sequencing, because we can follow in time and in space everything about this virus, which is extraordinary. So we can know a lot about super spreaders and wherever, if there's a change, a mutation of a strain, all that sort of thing. The other area that's exciting is, of course, in unknown diseases. And that includes even people who have sudden death of unknown cause. But there's a lot of people walking around with rare or unknown diseases, and we can quickly crack the case with sequencing and related genomic assessment. So it's the biggest one of all, of course, is in maternal fetal health, because you can diagnose any chromosomal abnormalities of the fetus in advance, just at 10 to 12 weeks. So that's changed. The numbers of amniocenteses that are required now has gone to historic lows and may ultimately almost go to zero. So genomic medicine is across the board having a big impact. It was used very marginally before, and it was embraced when we had to have physical distancing, and there was no other out for people to get seen really, unless they went to an emergency room. People were afraid to go to the hospital. Now we're seeing that back off a little bit, because people are able to go in for regular appointments and that sort of thing. But what was great about it is we learned the positives. And the fact is, it's so easy and quick. And right now, it's just a video chat, essentially, unless you have a skin rash or there's something you can show during the encounter. But the things that are really good about it is, one, you see a patient in their home environment usually, and that's something you wouldn't otherwise see. The other is that because of the practical aspects of how quick and get rid of all these other intermediate unnecessary steps. But what we're going to see is this telemedicine 2.0, which is objective data that's exchanged, shared from the patient, either before the visit or during the visit, such as sensor data, imaging data, results of labs, whatever. And so it'll start to get more objective. And believe it or not, there's a way that the physical exam can be done almost in its entirety. And that's in the future as well, by the patient during the encounter. So telemedicine is it got big legs during this. It's kind of a silver lining, if there are any, in this whole crisis. But, I think it's here to stay. It's going to be used not for the most serious matters, but for the simple, more routinely. And the good thing is it'll decompress, so we'll have more time for the important stuff to be together, which is essential. AI has been around for a long time, 50 plus years, but only in the recent years, really the last 4 or 5, has the deep learning subtype come along, which is basically taking inputs, whether it's images like medical scans or speech or text, massive data sets, and being able to get outputs that give interpretation as good as people could do. And so there's neural networks, these deep neural networks are really extraordinary. Now, what's the promise, of course, is the immediate thing is that we're already seeing is improving accuracy. So scans that a radiologist might look at, or eye photos of the retina, or OCTs of the retina, or electrocardiograms, all the things that we use in medicine every day of patterns. Now, what you're bringing up is another exciting area in mental health, because up until now, we haven't had a quantitative, objective way of assessing a state of mind. And since depression is the singular biggest burden in health, as well as other mental health conditions, the fact that we could track a person by their speech, their breathing pattern, so many other ways that we could actually in real time, without passively, like the way they type on a text or on a phone or keyboard. So there's all these different ways. And the point being here is we're getting to an objective assessment of state of mind. And that will help in terms of being able to, whether it's with changes of cognitive behavior therapy, or if it requires medications, or whatever it takes, to each individual to hopefully get to a better state when they are depressed, to try to prevent that, to manage it better. Obviously, the stress of the pandemic has been an enormous toll on everyone. But now we have new ways to counter that. But frankly, I'm not as excited about that and the accuracy as I am about the gift of time. Because today we have so limited time with patients. And it's just, it's really horrible how this has degraded the relationship over the years. And with the promise of AI and deep learning is that we give back time to the patients and doctor relationship, and all clinicians, because there's get rid of keyboards, liberate, because we can use voice, and we can use so many parts of this, which I reviewed in the Deep Medicine book, where this gift of time starts back the human bond. And when we get together, we don't have this 7 minutes or 9 minutes, but we have a time to listen and not interrupt, and develop trust and a presence and empathy and communication, all the things that are the essence of medicine, in counter to the burnout and depression of clinicians that we have today. Ophthalmology has led the charge in AI so far. A lot of people think it's radiologists, but the highest quality research has been in ophthalmology. And what's fascinating there is that in the retina pictures, it's not just learning about eye diseases. We can know about a person's blood pressure management, their diabetes management, their kidney disease, whether they are at risk for Alzheimer's or progressing. I mean, it's extraordinary, because these are things we can't see. But through trained deep neural networks with large data sets that are carefully annotated, we train the machines to see things that we can. And it's pretty impressive what we can get out of that. I'm optimistic that it's already taking hold. It's still the early days. So, I mean, we have to keep that in perspective. But, certainly these algorithms are being adopted it's certainly in radiology is one of the front runners in terms of actual practical adoption. So I think, we will see gradually, not like a light switch, the adoption. And what we're missing are, really rigorous, like randomized trials or prospective trials. But there has been, for example, a prospective trial in diabetic retinopathy. And you can go into many grocery stores now throughout the US, and if you're a diabetic, you can get a screen with no doctor, just, with basically an untrained person and algorithm. And half of diabetic people until now were never screened for retinopathy, the leading cause of preventable blindness. So, just think we have made some advances, and they're usually associated when we've done really good prospective trial work. We need more of that.